Hi, can everyone hear me?
Yes.
Okay.
Yes.
Hi, everyone, and welcome to another one of the special topic series webinars presented by the Domestic Violence and Housing Technical Assistance Consortium. My name is Heidi Notario, and I'm with the National Resource Center on Domestic Violence. And today, I'm accompanied by a group of extraordinary researchers and practitioners that will talk about racial equity in safe housing as part 2 in this series. Before we get started, I would like to make you all aware that we are recording this webinar, and also that please mute yourselves to avoid background noise. Also, I would like to invite you to tell us who you are. So if you don't mind using the chat to introduce yourselves, that will give us a chance to know who is with us today. And also a reminder that the chat feature is there for you to submit questions and comments if you have them. And we will do our best to answer all of your questions and comments as we get through this presentation, and we'll follow up if necessary. So with me today, I have Latoya Young from the DC Coalition Against Domestic Violence, Khadija, who is a survivor and practitioner. We have Shanti Kulkarni with the University of North Carolina, Charlotte, and Evelyn Hill from Change Choices. I'm also here with Mariam Durrani with the National Resource Center on Domestic Violence, and Brittany Eldringham, who are here to support this presentation. Next slide, please. Just as an introduction, for those of you that don't know, the Domestic Violence and Housing Technical Assistance Consortium team is comprised of federal partners, the Family Violence Prevention and Services Programs, HHS, the Office on Violence Against Women, the Office for Victims of Crime, the Office of Special Needs Assistance Programs from HUD, and the U.S. Interagency Council on Homelessness, and a group of national technical assistance providers, the National Alliance for Safe Housing, Collaborative Solutions, the National Network to End Domestic Violence, the National Resource Center on Domestic Violence, the National Sexual Violence Resource Center, and the Corporation for Supportive Housing. Next slide, please. And to start, I would like to share with all of you an infographic, an animated infographic developed by the National Resource Center on Domestic Violence in partnership with the DV Consortium on the intersections between domestic and sexual violence, racism, and homelessness.
Experience compounded barriers. Homelessness is an issue that far too many people face. People of color, specifically Black people, other persons of color, and Indigenous people, experience homelessness in a dramatically different way than their white counterparts. People who hold multiple identities, such as those who live at the intersections of disability, immigration status, sexual orientation, gender identity, and more, experience compounded barriers that further homelessness and housing instability. A recent study found that 66% of people experiencing homelessness were Black, while 28% were white. Black individuals are only 13% of the US general population, compared to 74% of those who are white. Rates of homelessness within Native communities are 3 to 8 times higher than that of the general population. In total, 78% of people experiencing homelessness identified as people of color. This overrepresentation of Indigenous, Black, and other people of color experiencing homelessness cannot be explained by poverty or identity alone. Structural racism, Historical policies, institutional practices, and cultural narratives that perpetuate racial inequity put people of color at a disadvantage in obtaining safe and affordable housing. Statistically, women of color are much more likely to experience domestic and sexual violence, and survivors often face network impoverishment. Network impoverishment occurs when the addition of a financially distressed household member places an extra strain on family resources. Oftentimes, we tell a survivor experiencing homelessness to go to a relative or friend's house. However, network impoverishment can cause immense burdens on the existing limited finances and available support from that network. Racial disparities arise at every juncture, from the legal system, to housing, to healthcare, to child welfare, to public benefits. Understanding the intersections between domestic and sexual violence, racism, and homelessness, and applying an equity, survivor-centered lens in our work is the only pathway to stability, safe housing, and healing for all survivors. If we want to address racial inequity, we have to acknowledge it, learn about it, and talk about it so we can do more about it together. To learn more, visit safehousingpartnerships.org.
So in addition to what we just saw in the brief infographic, I just wanted to highlight some of the statistics in our commitment to center racial equity and particularly Black lives in our work. We know that this intersection of racial inequities and housing insecurity impacts disproportionately Black people, Indigenous, and people of color. And we know that Black people are dying at a rate more than 1.5 times that of the rest of the population. Many states are effectively erasing Native Americans from the data sets by classifying them as other. Where tracked, several states have found severely disparate rates of infection or death among Native Americans. Research suggests racial residential segregation is a fundamental cause of health disparities. We also know that communities of color disproportionately live in neighborhoods further from grocery stores and medical facilities due to historical racial discrimination and redlining in housing policies. And we also know that many people of color live in federally assisted housing, including public housing and Section 8 programs that are often in segregated neighborhoods with less investments. Challenges are exacerbated for people of color living in rural communities, being counties away from facilities and service agencies. So it's really important that when we think about racial inequities, we are able to be very clear about the context and the reality of structural racism. Next slide, please. So before I turn it over to our presenters, I wanted to give a little bit of context for the work that you're about to hear in a moment. This group of researchers and practitioners have been tasked with specifically paying attention to the lived experiences of Black survivors and survivors of color at the intersection of housing insecurity and domestic and sexual violence. So what you're going to hear is a study that was conducted last year and that continues into this year and the following, that specifically looks at what impacts and what are all of the pieces that impact survivors' lives and what are the factors that keep them unstably housed. And in some cases, for those that have been able to gain stable housing, what gets in the way of maintaining their housing. So without any more delays, I'm honored to introduce Latoya Young and Khadija to get us started on this topic. Welcome.
Thank you, Heidi. Good afternoon, everyone. I am Latoya Young, the Housing Systems Coordinator for the DC Coalition against domestic violence. Today, I'm joined with my co-presenter, Khadijah. Khadijah, do you mind introducing yourself?
Hi, everyone. I'm Khadijah, partner and member of the Survivor Advisory Group. Thank you all for having me. This topic is dear to me as a Black woman, mother, and survivor. Today, you'll hear a candid, open, and honest discussion about what came from the group. So please be prepared to hear and take away some golden nuggets from our report. And just to add, I do have my little coworkers in the next room. So if you hear anything, that's who's in the background. Just a heads up.
Thank you, Khadijah. Before we get started with our presentation, we wanted everyone to take a brief 5-second acknowledgement and a 5-second pause just to honor and stand in solidarity with every Black and brown woman who has been victimized and or oppressed by systems, and for the continuous fight for liberation. Thank you. So today, just as Heidi mentioned, Khadijah and I had the honor of working together on a report within the group. And the purpose of the group was to really work with survivors to get a better understanding of survivors' housing goals and previous experiences around housing. But in order to do that, it meant that we had to do it in the most equitable way. And so we'll walk you through what it meant, and not only what it meant, but what it looked like to create equitable spaces for Black women to discuss, acknowledge, and to really bring up their experiences within housing. Next slide, please. And so it was important to us that the way that we did this work, the way that this group was developed, that it was a way that really recognized Black women and how Black women show up and what's the best way to do it. And so we developed 2 focus groups on the behalf of the National Resource Center on domestic violence. And those 2 focus groups were really composed of 12 Black women who all had survived intimate partner violence. At the time, most, if not all, survivors were living in DC, and it was important that we recognize that that was something that was common amongst the group members and our group partners. We acknowledged them as partners, and it was very important that they work with us and we work together to ensure that the experiences were documented and acknowledged in a way that was important to the women and the survivors in the room. And so we, and when I say we, Nkiru and I, which was one of our co-facilitators, Nkiru Nwazi is a well-known researcher in the domestic violence and gender-based violence field, and myself, we worked together to make sure that our group was developed in a way that they felt included and that they felt valued. In addition to that, it was important that we had a note taker that was able to document those experiences. We also had a tape recorder that we did not use unless everyone consented to the use of the tape recorder as a way to document a lot of the things that came up within that group. Now, this is the most phenomenal part that we're actually going to talk about in how and which ways this was more about equity than it was about compensation. And so in order for us to ensure that our partners felt like partners, it was important that they were compensated. They were each compensated $50 in cash, not just because it was important to us, but also because we recognized that their contributions were just as valuable as our roles and our responsibilities in delivering a report. And so the compensation was actually provided to each participant at the beginning of each group. And that was really to ensure that folks felt valued and that they had the opportunity to walk out at any minute, despite what we thought and that we felt. But it was really important for us to acknowledge that it's an intentional, deliberate, authentic way of committing to what we say and what we're here to do. In addition to that, the food, the transportation was all based on the decisions and the points of which each survivor felt that they need or that they wanted. And so we're also going to talk a little bit about what that meant. The child care services that were provided by a child care facility that we partnered with here in the district that was really by trained professionals who already are licensed child care professionals in the city. Khadijah, does this bring to memory for you anything about our groups?
Yes, definitely. After participating in a study with Nkuru, initially, I had a few reservations because I didn't know what to expect. But when I received Latoya, when I received your call, I was like taken aback because I was asked about, upon being invited, I was asked about the menu, my dietary restrictions, if I needed transportation, things like that. So it was a wow moment for me because I'm usually an afterthought as a Black woman who has to, seek assistance from the system. But in this moment, I felt included, and it was just something different than I was, usually had experienced.
Yeah, and that's actually something that we heard from a lot of the folks who were in the room, each and every one of the survivors, in fact. It was important for us that we model an equitable process in the way that we develop and conduct a group for the report. And so the way in which we did it, next slide, please, was a way that really created a culture that the report can develop and answer the questions that we'll talk about in a few minutes, and that survivors were in lead and that they led the process and that they led the group. And so from the moment that we developed the group and the moment that we consulted with survivors, we wanted to ensure that they were a part of the decision making. We wanted to ensure that Black women have voices, that Black women have power in how things were being conducted, not only within the report, but also within the group. And so the decisions that were made were actually decisions of the survivors and how the group was going to be conducted and how the report was going to unfold.
Back to what I was saying on the call, I was asked about, if I needed if I used public transportation or Uber, if I was driving, to suggesting even a gas card, which I did receive, childcare status, and even when I showed up, my children had there was a playroom, a play area with licensed childcare providers. And as a protective mother, I felt comfortable seeing them excited and, relaxed. So it ultimately relaxed me further to let my guard down as a participant. And this was equity for me, bringing survivors together and creating a platform and just understanding that we all have different needs and, taste and likes, and not just grouping us all together with the take it or leave it attitude. So.
Which is why we all wanted to make sure that survivors set the tone, survivors were stayed in the lead, and that survivors even created guidelines for what it would look like in the culture that was being developed at the time. And so there were member created guidelines around keeping a safe space, allowing everyone to be heard and to speak, and to also to be thoughtful of others.
As a group, we came up with guidelines on how we wanted to be respected and show others respect throughout the process. For me, we formed what felt like a mini sisterhood because we all pledged to show up and be present, be respectful without judgment. And that's what we learned to do as survivors. We created our own community of support in that room.
And so through these processes, we were able to build a level of trust that created autonomy for each survivor to make decisions, to make statements, and to really document their experiences in a way that really showed their commitment. Everybody showed up and everybody continuously was there to really commit to ensuring that this report was in fact what we were hoping for. And so the level of commitment through these experiences and developing a culture was phenomenal. It was even to the point that, Khadijah, if you remember, we actually had to put some people out. We had to say, okay, it's over, must be like, and so do you want to speak a little bit to that?
Yeah, for me, it was like I think the healing to go in to move into that. It was a healing process. Hearing the stories and drawing from others' strengths was therapeutic for me. I felt more vulnerable in the group than in other experiences with family or social circles, because it was a kinship and a connection to other survivors. Hearing their stories and even replaying my own experiences. Um, Usually, we all had a common bond from being caught or feeling trapped in the system, and the things that drove us there, and just the overall struggles as a Black woman. I feel like that plight alone is unique in itself, and it just made us feel comfortable and safe to be there. So we didn't wasn't trying to leave. Enjoyed it.
Yeah,
It was enjoyable.
it was. And the one thing that really stood out, well, not the one thing, but one of the things about the culture was that despite the backgrounds, despite the setting and not kind of knowing each other, there was a common language that was spoken, which was really the verbal affirmation. And we all kind of, as people talked about their experiences, members nodded their head to show agreement or understanding. They would pass the ball to either speak. And so this culture of survivors leading was really impactful and allowed the space for healing to happen in the room.
Yeah. Having Nkiru and Latoya was really refreshing. Not only because they're women or and Black women, but they came across relatable and genuine. And again, that's what allowed for me my guard to be let down uh, even further. I can't tell you how many times they both expressed, "This is about you all. We want to hear from you. We want to, know how we can create a comfortable space for you and create that culture." So, I mean, it was just amazing how the foundation was established early on.
Thank you. And all of this really was really a setup to lead us to really um, look at the guiding questions for what we wanted to explore and how we wanted to develop the report. Next slide, please. And so the guiding resource questions that we were really hoping to get at and working with the group of survivors was, what survivor-centered culturally specific strategies promote wellness and resist housing instability? It was important that we recognize that the experiences of Black women may look different, may feel different. Therefore, there may be certain challenges and strategies that they use in order to obtain housing stability or to achieve success in housing. In addition to that, we also wanted to know, what do we want systems to know? What is it that Black women, based on their experiences in housing, would like systems to know? And so we're going to dive a little bit into that. But before we dive into that, it was important that we understood what the challenges were for the Black women that were seated around the table that identified as Black women. And so we wanted to look deeply into that. And so we're going to look at some of the quotes and some of the things that we heard that really get to these questions. Next slide, please. And so one of the things that came up was really talking about some of the norms as a way of normalizing victimization of Black women. And so one of the survivors around the table said, sometimes your need of housing starts with domestic violence. When I went to get help, they acted like it was a normal thing as a Black woman. To this day, I don't talk to my family. I had to get surgery on my leg. Everyone acts like it's the norm for Black women to be victims of domestic violence.
I can definitely relate to that. I'm not sure why, as a Black woman, I feel like we have to scream and fight to get the attention we deserve. But that has become the norm. From healthcare to domestic violence, I feel like our pain is not perceived as actual, but back to being an afterthought. It's I keep saying that, but it's a real and sad truth. We're made to feel, kind of robotic as a fictional character in the book of life, when in fact our problems are real and arguably more real than others would like to, take responsibility for.
Yeah. And I think that was something that came up time and time again. In addition to that, here's what someone else said. As a Black woman, they expect you to be single, head of household in order for you to get services. And so when we heard that, it really made us to sit back and think about what that meant. What did that mean for you, Khadijah?
From a young age, I feel we're made to feel the absence of love from a man. Many have experienced the effects of, a father or brother being incarcerated, murdered, or dealing with, substance abuse related issues. So it makes us feel like we have to, you know, we're not good enough for love. We have to choose between the two, and you can't have one or the other. And it's really it's really sad that we're made to feel like unworthy, and I can't have love and I can't have support from a system at the same time. It's sad.
A lot of survivors around the table at the time expressed being forced to choose between love, whether it was a past relationship, a current relationship, or even a future relationship, and getting services and housing that they so badly needed. And so there was a expectation that every Black woman who came through the door, that they were single, that because they went through domestic violence, that they didn't deserve love, and neither did that mean that they can show up and express the love of a love interest or a partner. And so, in addition to that, one of the other challenges that we also discussed, and here's what a survivor said, was in the Black community, we need to get more classes on how the system should go. We need to know our rights. We need to hold people accountable. Other people from other cultures know they can go to the city council or somewhere else to make a difference. And so a lot of survivors around the group at the time talked about this as a challenge because from birth, it's almost as if Black women are taught not to challenge people. They're not taught how to hold people accountable and to have expectations.
We have such a rich history of oppression and racial injustice. Again, you start to feel unworthy of rights. We don't explore the question, what are my rights enough? And oddly, no one is waving a flag to guide us either. Um, it looks cool for an organization or a system in place to have pamphlets to tell you your rights, but it's not practical in a system that you don't trust. It's a piece of paper you sign that you receive, and that's that. Um, but does anyone ask the question of like your education level, if the information is even comprehensible, and what it looks like in the real setting? And then you have to even worry about, retaliation, even when you know your rights. What happens when you move forward and you act on those rights? So we need to know all the resources and what's available. I shouldn't have to be the model client to get all the assistance necessary or information necessary to better my situation. I feel like that is another thing that creates inequities.
Absolutely. And so, in us exploring some of the challenges and really kind of get into our first question around what are the culturally specific strategies that are doing, we also wanted to look at the challenges. And so, from the challenges, we moved to what are some of the strategies. Next slide, please. And so, We'd like to outline a few of the strategies. Of course, there were many strategies that came up, but here are some of the ones that stood out for us. One survivor said, I wouldn't necessarily say that they kind of force you to lie, but instead of lying, omitting information. Because if you know your chance of not being able to get this, and you really need whatever this is, and you give up this information, you won't get that. So if you just don't tell them information, so that's a strategy that kind of depends on the need. And so a lot of survivors actually talk about how the system almost forces you to not tell them something, how the system doesn't welcome the true whole Black woman coming to the table and their experiences in their need of seeking housing services.
I mean, having one thing shouldn't prevent you from having another. I shouldn't have to wait for one resource in my left hand to be depleted before I can get another resource that I need in my right hand. It just creates a cycle of unfortunate situations. And I feel like if you're really trying to help, help me because I really need it. Me showing up and asking should be enough.
Right. And I feel you, Khadijah, because a lot of times within the movement, within the domestic violence community, we say believe survivors, but do we actually believe survivors? Here's what another survivor said. We, as people of color, our rock bottom comes easier than most others. We already have our hard times early on. If I have to find a way, I will make a way. Khadijah, I know you spoke a lot about this.
Yeah, I mean, I guess it's just absolutely true. The system favors you at your worst, but the reality is stemming from even like from slavery and being set free without resources necessary to rebuild. As Black women, we've always been able to make a way out of no way. The saying, I was dealt lemons, but I made lemonade is synonymous to the Black woman. We've proven to be resilient and make good out of the scraps that we're given. Even if you take the pig, is not good for you to consume, but it's a part of our history because, and it's in our, in our diet and things like that, because that's what we were given, the scraps, and we made good out of that, from bacon to ham. But I don't eat pork, by the way, but
Right.
just saying.
Just saying that, and it's very true for a lot of Black women experiences around the table. There was another thing that we all acknowledged was a common strategy in which a survivor talked about being community and using our peers, other survivors, even survivors around the table as community, because there was the idea that we can't depend on the system. We as Black women cannot only depend on the system, we have to use each other and build community. And so here's what the survivor said about one of the strategies that they use. I have a system with my best friend to help each other out. We get paid at different times. So when I don't have it, she helps me out and vice versa. You have to have trusted friends who will share resources with no judgment.
I agree. I myself have been able to create a system within my circle of friends because I know I can't, depend on the system. We come together and we make schedules and things like that to assist one another and hold each other up. Just for an example, if you take the recent COVID situation and what is the school year is expected to look like coming this fall, it's almost impossible for myself to work and be a caregiver 3 days a week But as a single mother, I have to, create resources for myself, because this will, and I feel like this will disproportionately affect other Black women across the scale, especially if you are a single mom and those who are survivors who don't have that support. I'm curious to know what that will look like for those who are struggling to maintain housing. But because I have to make that sacrifice, I have to go to my friends and my family and say, I need you on this day, or I need you on that day, just to maintain, because I don't have, the system hasn't put anything else in place at this moment. But that's just a current example of that.
Yeah, absolutely. And I think another thing that both Incure and I acknowledge as something that we learned through this experience is, and we heard loud and clear, was that the system really limits a lot of people, particularly Black women, by expecting them to jump through hoops. And so when we're looking at our policies, when we're looking at our practices, we really need to design them and support people that will really support and invest in survivors. Um, Thinking about some of our housing policies and even how we define housing or homelessness, there's a lot of that really connects to this statement around using community. And so if you use a friend and a friend opens their space to you and you are living on their couch or sleeping in a multi-family housing, then technically you're not homeless. But what does that mean for families that are trying to engage with our system that doesn't necessarily define housing and homelessness in the way that we exist and experience it? Next slide, please. And so the report really was based on the experiences of survivors. And here's what we got to. The answers to everything that we really heard was that we need to shift the power in a way that creates equity. And so our services should reflect what survivors need and ask for. There should also be pathways that build and sustain family and community support. They should not have to choose between love. We should not have to choose or omit information in order to get the services that we need. Housing options should also respond to the immediate housing crisis that survivors experience and also provide a pathway to housing stability for survivors.
Um, if I can, I'm just going to briefly quote Malcolm X. The most disrespected person in America is the Black woman. The most unprotected person in America is the Black woman. And what I get from this statement is that the Black woman is powerless. We do not have the wealth or power, but one can shift that, especially systems can shift that by sharing the power and inviting us to the table. If not, we'll continue to build our own and, talk and yell across tables and nothing will get heard.
And so it was a phenomenal opportunity to not only develop this report, but to create this group of women, this group of Black women, of survivors who were ready and prepared to be at the table. And so each time survivors were really hoping that this wasn't a one-time thing. And so although we had two different groups of invitees, one group was really from our a study that we conducted earlier on in the year. Another group was based on our Speakers Bureau, who are a group of volunteers of survivors who are just hoping to contribute to the domestic violence movement in any way. They were all at the table at different times, and we almost had to force people, again, I think I said this earlier, to, okay, it's, oh, this is it. But that really led us to wanting to have more discussions around this and wanting to make sure that survivors are continuously invited to the table, because not only do survivors have voice, survivors have presence.
Yeah, I feel like systems need to not tell us what we need, but find out and listen and allow us access into the rooms so our voices are heard loud and clear. our pathways are unique to each individual. One may need one-time rental assistance, another a quality paying job to sustain or maintain housing. I feel like the system should collect data from real people and recognize that Black women are the data, we are the information and the physical resources, and we need to be treated as such. The days of one size fits all is outdated and contributes to the inequities in the system. If you truly want to know, what we need, it's time you ask us.
Absolutely. I couldn't agree more. And so, just because we're running out of time here, I want to make sure that we also note that another thing that really came out loud and clear is that survivors not only need connections and to be at the table, but they need something that's relatable connections.
Um, yeah, it was really magical, like in the room, because it was obvious, the group was led by two, well, we were the leaders, but a group of diverse Black women who all were survivors, who were all at some point, depending on the system. But we felt comfortable, we felt not judged or, looked at a certain way, or, because I spoke this way or I had this clothing item on that I didn't belong. We all, banded together and drew on our, what brought us together in the first place. So it was a beautiful experience.
I definitely would agree. It was a beautiful experience. And what we heard loud and clear, last but not least, was that Black women survivors need deep investments. Survivors don't need, Black women survivors do not need white people to save us. We need people to make deep investments. Not coming from a capitalist place, they don't think we need stuff, that we as Black women desire stuff. If we do, as Black women, we're too greedy. If a poor Black person says they want something or they desire something, then automatically they get tumbled. And so the question for everyone here today is, how do we invest in a culture that we believe that Black women desire investments and opportunities? An investment that really allows survivors to continue groups like this, for survivors not only to be a voice, but for survivors to be at the table.
Again, programs like Latoya and Kira offered, well, the focus group that they offered are vital to us as survivors. And I really wish, that they could bring it back. We need to be at the table and no longer an afterthought, but a pre-thought. Have us in mind, not just as a quota, a budget sheet or a charitable effort, but be intentional with how services are offered. Like tackle economic disparities, provide us with skills. I feel like it's all interconnected and you can't address one without the other. It's a larger picture, and inclusion is a word we can all take away from this today. Honor our existence and contributions, not only to this country, but the world. Black women can be and or birth the next president, inventor, doctor, lawyer, and more if you support us properly. Create long-term programs that provide, that prove to be beneficial and not just, a time constrained. Um, so to sum it all up, an investment in Black people and an investment in Black women is racial equity work.
Absolutely. And I think by us acknowledging the way that the group was developed, it allowed us to understand that people will invest and commit to opportunities and stay if they feel like they are invested into. The way that we build community is upfront, and we don't start with lack. And so we like to encourage everybody to understand that survivors need investments, survivors need opportunity, survivors need to be at the table. Thank you. I'm going to hand things over to our next presenter.
Thank you so much, Khadija and Latoya. I think your work is really inspiring, and I really also heard the voices of a lot of the women that we listened to in our project as well. So I'm going to talk about a similar project that that we did last summer that also utilized listening sessions and this what I'll talk about in a minute, called community-based participatory research, which is really letting survivors speak, letting, in this case, Black survivors and immigrant survivors, and tell us like what about their lived experience, and have that really become the framework. So what Evelyn Hill and I are going to talk about today is really, we've used this research to create sort of a framework about what women in marginalized communities are telling us about their experiences of housing. And that we really hope that this can then reframe how we see their situations, how we understand them, and then how we can position ourselves as a movement to be in service to that. So next slide, please. So, oh, and I do want to also acknowledge Evelyn and I worked together on this project with two other community-based researchers, Katrina Eichert and Danielle Archie. We also had another team of research that was based out of La Clínica de Pueblo, and they serve immigrant Latinx populations. And I want to acknowledge their contribution, and that's Dilcia Molina, Maria Emilia Vitalia, and Leslie Mancato. So, so we had sort of two teams working simultaneously, and held about 9 listening sessions during the time that I'm going to present on. I will say that the study is ongoing, because we're taking what we're presenting you today and taking that back to other groups of survivors to see if this resonates for them and what's missing, and to really fill in the gaps and really make sure we've accurately understood and represented what the survivors are telling us. So our approach is similar to what actually Khadija and Latoya described, is that we create like a space where everyone can be heard. We have some questions that we kind of pose out to folks around the things that we really want to understand better. And in this case, it's around housing challenges. It's around the sort of difficult and impossible choices that we force survivors into in terms of their housing. And then it's about what services are really needed and recommended from survivors' perspectives. And I think, just as we heard in the previous presentation, is that when you give survivors a space to talk, they want to talk, and they have a lot to say. And when they feel safe, and it's a trusted environment, that that really it is about the listening. So we did these groups. They were recorded and transcribed and then analyzed by the research team. And now, as I mentioned, we're taking them back to see if they're going to hold up. So next slide. And this is just a little bit of information about who we were talking to and the numbers. And so we had did 3 groups, and the partnership was with Change Choices, which serves formerly incarcerated women, and primarily African-American women that had involvement with the criminal justice system, but also experiences with housing challenges, and also as survivors. And then we had a slightly different population at La Clínica. And next slide. Okay, so this is the model I'm going to talk about a little bit. And one of the things that was really important, and I think something that was kind of a light bulb to me, is often when we have programs, we think we're done once we get people into housing, and we don't really see that the lived experience is really more of this cycle. Is that most of the women we spoke to, even the housed women, are not securely housed. Like, they may be one paycheck away or one health crisis away from losing their housing. And so that that sense of insecurity in that cycle is a cycle that these women really spoke about being trapped in. And so what we really want to think about is, what is that off ramp? How can we exit and help women to exit this cycle so they can become stably housed. Next slide. Okay, so the first thing we heard about, or wanted to talk about, was about the process of getting housing. And that, you know, this won't be a surprise to many people that finding and securing appropriate housing is very difficult. So first of all, that women spoke of the scarcity of housing, that there just really is a dearth of affordable housing options. And then what that means is that landlords really have all the power. And so there's extreme competition for these affordable units. And even as we've seen, you know, a proliferation of supportive housing and housing advocacy, is that often different groups are competing with each other to get these very scarce units. And because of this, then what we really hear is that stigma and discrimination and all these biases come in and really harm you know, Black survivors and Latinx survivors, immigrant survivors, because of this scarcity of resource. And so women spoke about experiencing, you know, landlords who may not want to rent to them because of their domestic violence background, or won't take a chance on someone who has a criminal background, or that that, you know, there's subtle or not subtle discrimination based on race or immigration or language, and that they experience this from you know, not just landlords and the general public, but service providers as well. And so it's sort of, I think was really pointed out in the last group, that this is the racist environment that people live in, right? And so that that can be a very challenging situation when you're experiencing these kind of assumptions from everybody. And then we heard about formal services that help people get housing, and that can be really a mixed bag. That some people really spoke about positive experiences, that they were able to get housing because of these formal services that were able to link them. But that also, it wasn't that easy, just because services can be siloed or kind of separate from each other. And so if you're plugged into one service, that if they see your mental health or your substance abuse as the primary need, they may have no expertise in housing and helping you to get access to housing. And even though, you know, survivors would talk about saying, this is what I need housing, the people that were working with them were not always equipped to provide that housing or provide that linkage. So next. So even when people got housed, those housing situations were far from stable for a number of reasons that may be, again, familiar to folks. So one is that the environments weren't really necessarily an environment they would want to stay in for a long time. And so that for some people could be about the housing was accessible to an abusive partner, or the partner was stalking them. Sometimes it was because it was in a neighborhood that wasn't safe, that there might be, because the affordable units are in neighborhoods where there's drugs or community violence, or there's not access to food, that there isn't good access to public transport. All these things keep people kind of unstable and isolated. The housing itself was often substandard. So women described, you know, really homes with mold or with vermin, or that they ended up having to double up into situations that were pretty overcrowded. That these homes were also unstable because of the strained household resources, the percentage of income that they would need to provide in order to pay these very high rents wasn't sustainable either. So especially if they were in a situation where they had low wage work, or health problems, or childcare challenges, or transportation, or if trauma kind of came up in a way that interfered with their ability to earn or have an income, that was a problem for, you know, staying stably housed. And then I think, as we saw in the video, the network impoverishment was it was something we heard about as well. As so in a lot of these communities, everybody as a community is experiencing this oppression. And so when people are struggling, they aren't always in a position to provide support. And that we also heard that sometimes relationships damaged by DV actually made it less possible to reach out to so like friends and family for support. And the other thing we did hear about was sexual exploitation. And so often in these units, like if you're short on the rent or if you need a certain repair, that, you know, landlords or repair people would offer want sexual favors in order to have people kind of give people what they need. And so this was like a very difficult situation. Formal services were also there. You know, there are formal services that provide rental assistance or emergency grants and those kind of things. But they also talked about is those aren't easily accessible. And again, I think we kind of know this to be about the scarcity of those resources in a community. And so often service providers create significant barriers to figure out who deserves help and who doesn't deserve help, and bias can come into that as well. So it's never clear. There are often you really have to demonstrate like that you deserve this help, and that and it's really confusing about where to go. Okay, next. And then finally, we heard women again and again talk about this loss of housing that was common, and that could happen because of eviction, which in our state, North Carolina, could happen quite quickly. That also gentrification was an issue. So even if you are able to find affordable housing, that that those rents can increase, and they might increase beyond your ability to pay. And then there can be all kinds of other financial or housing crises that would cause people to lose their housing. So next. So we also wanted to think specifically, how did domestic violence really affect survivors' experience within this cycle? Because this is a cycle that keeps people trapped, right? So it keeps people trapped who are Black or from some other oppressed group, or who are poor. And but domestic violence also played like sort of a unique role within that. And some of that was about, we heard about abusers' interference with survivors' efforts to become more independent, or abuser impact on somebody's credit or housing history. That was something that was unique for survivors. We also heard that survivors, you know, even as they were leaving these DV relationships, didn't mean that they wouldn't have new experiences of trauma or violence, that often they were vulnerable in different ways to people taking advantage of them, or abusing them anew, or being a victim to community violence. That survivors, as they exit, also need time to heal, and that time isn't always factored into sort of the pressures they have to support themselves and to be housed. And so some survivors talked about, you know, once they're housed is actually the time when, okay, I've been struggling, and now sometimes you even fall apart because you have that security of your own home and you've been holding it together for so long. And so, but it's really hard to fall apart when you have to pay rent and kind of live up to all these expectations. That they might find new triggers in the environment where they are. Especially, we heard this a lot from women who are in unsafe neighborhoods. And then we heard a lot about social networks that were strained, and we talked about that a little bit. But there might be damaged relationships with family and friends. So that might be because, you know, that sometimes friends and families would be frustrated with survivors for not leaving when they thought they should, and just not have the patience with them. Sometimes it would be because abusers or partners kept them from family and friends and undermined those relationships. And so there was a lot of prepare that had to happen that was related to this relationship that women also talked about, sort of the isolation and shame they felt, and that was hard to reach out. And it was also hard to trust people after going through an abusive relationship. So next. So I'm going to turn it over to Evelyn now, and I think she's going to share with you what we think, what kind of recommendations came out of this for how we think this can improve services and policy. Evelyn, are you there?
Evelyn, any chance you're on mute?
Can you hear me?
Yes, there we go.
Okay, there you go. You can hear me. Okay, so I'd like to thank everybody for coming. This is a very important topic for me, not only professionally, but personally. Just a little bit of my background. I'm what most people would consider a trifecta. I am a single African-American female with 4 children, 2 grandkids, formerly incarcerated. I've been home from prison now for the last 3 years. I was released in 2017, and I'm also a survivor of domestic violence. So I think I probably hit every major situation, as my grandmother would call it, that could possibly be hit. But some of the recommendations that we came through when we sat down with ladies, and the fact that I was able to sit with these women who had similar stories as mine was an honor for me. One of the first recommendations was increasing support for healing and empowerment. And what that looked like for most ladies was that we had to get past the fact that we at one time were victims. I don't like that word. I feel like that word has a preconceived notion of us being weak. We are not weak women. We are women that were involved in situations that caused a lot of, I want to say, shame, some guilt. It destroys families, sometimes lives. So when we talk about healing, we're talking about being able to sit with people that can understand. We're not looking for sympathy. We're looking for empathy. We need you to understand the situation, not pity us, because we don't sit around and have pity parties. I can guarantee you that. One of the other recommendations was challenging public attitudes about domestic violence, incarceration, immigration, and race. Now, me personally, I hear a lot of people saying that, we're asking for a seat at the table. My personal views are I no longer want to sit at a table that's encompassed with systematic racism. I would rather prepare my own table. I would rather be given the economic ability to make changes so that when we move forward, domestic violence, former incarceration, and race no longer is at the forefront of the conversation. It is a conversation that needs to be taking place. However, it doesn't need to be the primary conversation. I think economics is our problem. When you look at protecting tenants' rights and educating landlords, I think people need to be educated on the fact that even though we are now survivors of domestic violence, we still need safe and affordable. They cannot be interchangeable. They're one and the same. Don't put me in a house and think you've housed me that's putting me in a drug-infested neighborhood or gives my abuser still access to me where I'm not getting the protection that's afforded to me by the police or the system. So when I look at expanding resources and access, it does come down to financing. The money needs to be allocated for the communities that are at risk, and that's usually going to be Black and brown communities. Women are no longer expendable, and I know for a long time our rights have been trampled on, and for a long time we don't get the same services that we're entitled to. And I think that fight must continue. I think when you look at all of this, all of our recommendations, what it still boils down to is women's rights, and people have to be willing to change their minds so they can change their hearts. And that's the only way we're going to be able to move forward and have economic stability, fair housing, adequate health care, no longer living in food deserts, no longer living in housing that's substandard, where landlords are allowed to not spray for roaches or bugs. The police are not policing the neighborhoods like they need to, and that we're affected with drugs and violence. All that needs to be cleaned up. And the only way you can clean that up is we have to have a conversation. And I think this is the start of that conversation. So, and I know I probably sped through that. I'm sorry. But what do you think of these recommendations? Is there anything missing, or what would you see as a priority for women and minorities?
So Brittany, we talked about if there's a way to make this like more interactive, or if we want to just move to Q&A and kind of pick up these questions there. Do you know what will work best?
So there's no real way for participants to speak, but if folks want to pop their thoughts into the chat box, I'm curious if Khadijah or Latoya have any thoughts about these recommendations or priorities. What do y'all think?
Yeah, I would love for to hear from Khadijah and Latoya.
Folks can also feel free to put their responses in the chat, and we do have some questions that folks submitted with their registration, so we can kind of wait another second, see if folks have responses, and then pivot to the Q&A if it seems appropriate.
Thanks, Brittany. And this is Miriam. If anyone wants to respond in the chat, I'm happy to read that out so everyone is on the same page. So if you have any thoughts about what Evelyn has talked about and what Shanti has talked about in terms of the recommendations that you see on the screen, you're welcome to share those. Thank you in advance for those who did submit questions for our fantastic presenters. I'm happy to popcorn those out now to our presenters and see kind of where we land on some of those. But I will give a moment to the chat and see if anyone says anything else. Okay. So we have some thoughts in terms of increasing healing is absolutely essential, and everything she said was spot on. Thank you, I totally agree. There need to be a comprehensive and long-term assistance, so it's not one and done. Linking the domestic violence, incarceration, immigration and race, intersectional oppressions, and your liberation is tied to my liberation. Thank you for that, Kathy.
Miriam, Latoya is saying that they can respond as well, so I think we could turn it over.
Sure, yeah, Latoya, go ahead.
Yeah, so thank you, Evelyn and Shanti. This was phenomenal. It actually spoke to a lot of what we saw and what we heard in the groups that we convened with survivors. And I think in terms of increasing support and healing, there needs to be like a multi-level response, right? And so it's not about what we're doing just on this level, but it needs to also happen at a systems level. It needs to happen in housing systems, in our judicial systems, and it needs to really be a way that survivors are included. It needs to be intentional, authentic, meaningful, meaning survivors do not need to be tokenized, right? Because that's not a way to empower survivors. I think, you know, when we think about power, we need to think about how we shift power, because it can be really uncomfortable. And it really can, I'm looking at number 2 here, challenge the attitudes about domestic violence, and even challenge the attitudes in which way we think about Black women. right? And so when we think about that, we need to be able to be ready to understand the indicators of power. Who holds the most power, right? How do we know who holds the power? Because of your position. Because you can't observe power in your place of power, which means that we need to ask the people who are closest to the pain, how do we get you to the power? We need to invite them to, so that they can feel empowered, so that they can understand, and so that we can challenge attitudes around domestic violence, incarceration, immigration, and race. We need to be able to allow opportunities for survivors to co-create with them and tell me, how do we show up, and how do we continuously show up? How do we set the agenda in a way that allows people to shift and allows people input and to co-create? Khadijah, I know you may want to add a little bit to this.
Yes, I absolutely agree with what I believe Evelyn said about economics being the, I guess, like the starting point or foundation for all of these preliminary recommendations, especially for me, because I feel like as a survivor, a lot of times, for example, I didn't leave my situation because I was in a situation where I was a stay-at-home mom, and I thought I did everything right. Like, the man is the provider, and this is, he's going to take care of this and that bill, and I'm supposed to just take care of the children. But if I had the economic resources, or I felt like I could, at that time fly on my own, I would have left that bad relationship a lot sooner, because I knew that I ran the risk of, if I leave this, what am I going to? Dragging my children through a system, or, sleeping God knows where. But it still offered, the same person that offered me the abuse offered me the safety and security in some ways at the same time. So for me personally, I feel that the economic situation is definitely important, because it will prevent, one from being in a cycle, and not, having to stay in it long. So definitely increasing those resources and granting us access to different skills that can empower us and allow us to take our power back is very important. So I definitely agree with everything.
Yeah, I agree with everything that's being said as well. And just I think when you were saying, Khadijah, and you too, Evelyn, about economics being like the primary issue so many times, and that as a movement we haven't always understood that very well, because we've I think this is changing, hopefully, but I think we've thought of domestic violence in this really narrow way. And when we really listen to women, we hear about the economics, and we hear about the racism, and we hear about all these other things that we haven't really thought it was ours to deal with or fix. And I think that has to change. And I'm just curious too, what you all would think about. It sounds like what I'm hearing is this idea about tables, and that Latoya is saying we have to be at multiple tables, and Evelyn is saying we have to make our own table, or we need to go to survive different tables. So I'm just curious if you guys can talk more about that, or Evelyn, what does that mean to you to make your own table, and how do we get involved?
When I think of creating our own tables, I just think of us putting ourselves in a position where we are economically stable. And I know it's not always feasible. Like now, my kids are grown. I'm looking at 18, 19, 24, and 28. I'm able to work 3 jobs, not because I want to, but because I want to make sure that I can always live in a place that I feel comfortable, and that I don't have to worry about walking outside my door at night to gunfire or drugs. So I choose to live a certain type of way and it requires me to work to get there. Now, would it be better if jobs paid more? Of course. There's all kinds of conversations that can come to the table, but we first have to be able to understand that and accept that most Black and brown people, women and men, don't get paid the same as their counterparts. Therefore, we don't even begin to have a seat at the table. You know, it's like we're standing in the back of the chair waiting to be pushed up towards the table. So when I say create our own tables, I'm just thinking of things need to be more equal. Maybe we do need to open up our own businesses. Maybe we need to further our education. I'm in school now. Maybe that's the answer. But it can be multiple aspects to the same question. We just have to decide what works best for that particular person. Everything is not going to be cookie cutters.
Thank you so much, Evelyn. Latoya or Khadijah, did you have any thoughts about Shanti's question?
I think of tables as in we want to be, as survivors and as a Black woman, we want to be heard, and we want to be invited into the room. Basically, a lot of times we're excluded, and we're just, you know, information or data or statistics. But when I say invite us to the table, it's invite us to be a part of the decision-making process. I mean, because ultimately the decisions are going to impact us, you know, more than anybody else. So we should be a part of that. We should, and that's why I said a word we can take is inclusion. We need to be included. You need to include us in these things and not tell us what we need. How can you tell someone what they need when you aren't them and you haven't been in the situation, and you know you're so far removed and on every level? You know, I mean, we're all human, but at the same time, how we think or how we, you know, our environments are different. What shaped our, you know, our views are different. So you can't tell me what I need. I have to tell you what I need, and then we can work together to, you know, facilitate that and make that, you know, the outcome be, you know, beneficial for both parties and good for everyone. But you can't just tell somebody what they need. Everyone should be respected in their experience and not be, how can I explain it? I don't want to necessarily say overlooked, but just more so respected. Respected, I know what's best for me, and not just judge me that I'm not competent because I've gotten myself in a situation or I come from a certain background. So I guess that's what, for me, what table represents.
Thank you so much, Khadijah. I think that's incredibly valuable and important. Latoya, did you want to add anything else before we start turning to some questions in the chat and that people sent in earlier?
Yeah, sure. I think it's important that we recognize when we talk about being invited to the table, when I hear Black women who are survivors talk about being to the table, they're really speaking to the conversations that are already happening. They're also speaking to the rooms that are in white spaces and the rooms in which they know are there, right? And it's the gaslighting. It's just like, hey, we're over here. And they're like, okay, we'll get to you. And it's just like, no, let us in. And so that's what we're hearing. We're hearing that, you know, we are willing to show up. We are willing to tell you what we want, what we need. We just want to be heard. They also have, you know, we also have a group of survivors who are already like continuously show up. This is Khadijah's first webinar. This is her first time presenting. So I am so proud of her right now. I just have to say that because she continuously show up. There are many others just like Khadijah who are willing to show up, who are willing to participate, who are willing to guide these discussions and to lead in a way that we need them to lead. They just need help elevating their voices, elevating their experiences and the concerns in those spaces. And so if they don't, just as we're saying in the Black Lives Matter movement, it's still going to happen. They're still going to build their own table, but they shouldn't have to, you know, if we can work together to make it happen.
Thank you so much, Latoya. So a question that I want to turn into that was sent in to me in the chat and then also that was proposed earlier is Latoya and Shanti, I think either of you could speak to this. Can you talk about how survivors are currently supported in public and assisted housing and like what structures are put into place to help them transition out? I think we've talked a lot about gaps, but I don't know if we've necessarily covered kind of what exists right now.
Oh, I'm sorry. So what structure? Can you say exactly what for?
Sure. How are survivors currently being supported in public and assisted housing, and what current structures exist to help them transition out of it?
Maybe Latoya, you can follow up with some more specific. I think this is an area where there's a lot of room for improvement and innovation. I think it varies a lot community by community. And I guess what I would say is in general, to the degree that these like programs are successful really has to do with what all of the presenters are saying is that are they really responding to what folks are needing, you know, and what folks are asking for, or is it more driven by what's available or what is being rationed or and so I guess, you know, I think the best kind of services are services that are, you know, survivor centered, that they're trauma informed, that they're racially equitable, and that they're comprehensive, long-term and individualized. And I think it's rare to find all of those things, you know, because it does take that sort of investment. But I don't know, Latoya, if you have some better kind of examples of folks that are doing well in this area.
Yeah, a lot of the work that's been done is based on a lot of the groups that's happening within the domestic violence community. I know there's a VOWA work group that a lot of my housing partners, particularly here today with the DV Housing Consortium, that they have been working with HUD, they've been working with our partners at OVW, and they've been working with our partners that are in the public housing, the public and Indian housing unit to ensure that we encourage compliance with VOWA, so that survivors' rights and protections are not only recognized, but that they are implemented within the public housing authorities nationwide. And so I agree with Shanti, it looks different from jurisdiction to jurisdiction, but we're actively working to ensure that we elevate the concerns and we elevate the needs of survivors, particularly in public housing here, DC locally. There has been a lot of advocacy, particularly from our housing advocates, around how public housing doesn't really create a safe space for the people who are living in, particularly low-income residents. And so those units have been unlivable. They've had, you know, rodent problems and so forth. So there's a lot of conditions that don't support safe housing. And so our goal has been to address those needs and to continuously elevate the needs of survivors and Black and brown people who are a part of those communities.
Thank you so much, Latoya. I think we've already covered a few of the questions that came up in the chat. I know Bobby mentioned changing a coordinated entry system. I don't know, I know that coordinated entry is a complicated minefield in terms of prioritization and how that works for survivors. I don't know if Latoya or Shanti, either of you want to speak to that, or we can continue on.
Yeah, again, I'm not an expert in coordinated entry, but I don't know. It's a hard thing, because even when we prioritize like survivors, and there may be, I think definitely there's some issues about how we prioritize folks, but if we're not doing anything to increase the quality and the amount of affordable housing, it seems like coordinated entry prioritization maybe isn't going to get us to where we need to go. But I don't know if other people might have anything to add.
Yeah, I would agree. I think when we look at coordinated entry, we need to look at our policies, our practices, and how we are working with our COCs, and also how COCs are working with us, right? And so it becomes more about ensuring that we have those difficult conversations and that we also address what prioritization is and what that means for the people that are involved in these systems. Because what we're hearing from a lot of people who are trying to access housing through coordinated entry is that prioritization may not feel like they're worthy of housing, particularly because of the assessments that are required in which you have to score. And so a lot of people have different experiences, and it's important that we recognize that safe housing is something that is essential to all people.
Thank you so much, LaToya. I think that's incredibly valuable. So I know that Sheena also mentioned, how can a field better support survivors' exploration of and programming that centers building economic power through entrepreneurship and building resources? Do you, Evelyn, Khadija, LaToya, Shanti, any thoughts on the economic power that can be built in this process? I know we talked about long-term investment. I know we talked about investment broadly.
Yeah, I think that we really need to be very creative in the kind of cross sector partnerships we engage in, that really, because I think we have a expertise in IPV and oppression and all of those things, but we're probably not all experts on building affordable housing or encouraging entrepreneurship, or, and these are things we need to know about. But I think finding partners who are doing that work, who are doing work in different kinds of racial justice and social justice and economic empowerment, I think really finding who those folks are in the community and looking at like sort of our shared interest and priority in helping survivors to be economically independent is really critical.
So I would, to piggyback off of that, I would say that we need to, have systems in place that, support wealth building for survivors and Black women, whether that be, skills. I know when I was in high school, we had things such as like, you bake, things like that. I know like in DC, they have like cottage laws, ways that we can encourage entrepreneurship. Not everyone, is fit for necessarily to go to college, but have other trades in place, put trades back, make trades more widely available so we can have skills that, will allow us to go out and create, wealth for ourselves. I think that that's really important. I feel like what I've learned as far as wealth building is it's tied to the amount of money you make. Sometimes is tied to the value that you can create. So if we have the skills that we can, offer value and things like that, I would assume that it would be the dollar amount attached to that would be substantial. But when you don't have those skill sets, or you don't know how to, create that value on your own, then you're just, again, you're caught in a cycle. And the cycle is applying for jobs that you may not be qualified for, or getting a job and it's not enough to pay, for your living or your housing. And I'm from the DC area, and it is extremely expensive to live and to maintain even what some call affordable housing. So it's definitely important when you speak of economics to look at how can we generate this? How can we, we should know about even stocks and things like that. It's just so many resources that we're locked out of when it comes to generating wealth. Things that we don't know about, balancing, books or, checkbooks or, how to do your taxes, and just things like that, how to fill out certain forms. We just lack the knowledge of that. And it's time that we have systems in place that will teach us that, because in school we're taught, you graduate, how the saying goes, you graduate, you get a good job. You go to college, then you get a good job. But as a Black woman, my high school diploma is equivalent to I would say a white woman's 4-year bachelor's degree. So I'm already behind. That may not work for me. So there needs to be other, discussions around that.
Thank you so much, Khadija. There were so many incredible options that you shared. And, I think it's just a lot of creativity and a lot of options and a lot of investment, work, and education needed. So we are at time. Thank you so much to each of our panelists. They were absolutely incredible. I'm going to turn back to Heidi to wrap us up. And I just want to personally thank everyone who's able to attend our webinar today. So Heidi, do you want to wrap us up?
Thank you, Miriam. And with that, I also want to extend my gratitude to all of you panelists. I have to add to the list of comments. I can't believe, Khadija, that this was your first presentation. And Evelyn, you both were extraordinary, bringing your lived experiences into this space. I think we've heard from all of you that we're at a critical point, and we know that at this time we have to more than ever center survivors, particularly Black survivors, because we know how disproportionately they are impacted. We put a lot of emphasis on the importance of having survivors be equal partners in research practices and processes. And I want to take a moment to highlight the community-based participatory research toolkit that's housed on the NRCDV website. In there, you'll see more about the principles of CBPR, and you'll meet Nakiru Nabulesi that you heard so much about today. She's interviewed on the toolkit. I highly recommend that you all visit that if you're not familiar with it. We heard about the importance of real economic advocacy as we are trying to end violence and resolve the problem of housing insecurity. And we heard a lot about the emphasis and the importance on long-term supports and advocacy. So with that, I'll just close our webinar today. And once again, thank you all for being here with us, and we'll be in touch.